Hello, my name is Rachel Fox. I use she, her pronouns, and I am an assistant professor of interdisciplinary studies at Grand Valley State University. And thank you for joining me today for this summary of my dissertation that I originally presented at my defense. My dissertation is titled Misdiagnosing Fat Oppression, Weight Stigma, and the Anti-Obesity Assemblage. We live in a world that is profoundly hostile to fat people. In fact, the US has declared a war on us, the war on obesity. For as long as I have been alive, the primary messages that I have received about fatness are that fatness is pathological, that fatness is burdensome on fat people, our friends and coworkers, on the healthcare system, and on the US as a whole. I've lived through a world in which bodies like mine are portrayed as an epidemic that needs to be eradicated. And in this age of medical distrust and controversy, one message that seems to unite nearly everyone is that the world would be better off if fat people didn't exist. This dissertation debuts a new approach for the field of fat studies, one focused on the structure constituted by the efforts to produce a world without fat people. Despite many people recognizing that there is some sort of structure constituted by anti-obesity efforts, this structure has remained unnamed. So I have named it. The concept I have developed to describe this structure is the anti-obesity assemblage. The anti-obesity assemblage is a network of human and non-human actors that enables and enacts the elimination of obesity. It is a material discursive structure constituted by all the people, technologies, institutions, and discourses that participate in or are part of anti-obesity efforts. My dissertation studies the anti-obesity assemblage and the ways that it shapes the oppression of fat people in the US. Specifically, I study one part of the anti-obesity assemblage, weight stigma research and advocacy. Many weight stigma researchers and advocates are committed to fighting both obesity and weight stigma. And this makes their work a useful context to study the anti-obesity assemblage because it highlights how efforts to produce a world without fat people perpetuate fat oppression even in the fight against stigma. I find that the anti-obesity orientation of weight stigma research and advocacy contributes to fat oppression in two primary ways. First, fighting obesity and fighting weight stigma are two different goals. And at any given moment, weight stigma actors can only prioritize one. I found in multiple contexts that weight stigma research and advocacy consistently prioritizes fighting obesity and directing resources towards this goal over fighting stigma. In my second chapter, I compiled a corpus of all the academic research on weight stigma, and then I coded a random sample of 400 articles to see if they prioritized fighting obesity or fighting weight stigma. I found that nearly 2/3 of them prioritized fighting obesity. Thematically, I also found that researchers prioritized investigating the causes of obesity and the barriers to obesity elimination over investigating the origins of stigma. I also found across all of my chapters that when weight stigma researchers and advocates are given the chance to make recommendations to improve stigma, they consistently advocate for educating audiences about the complex causes of obesity rather than any actions oriented towards improving the social standing of fat people. In my review of weight stigma interventions with health professionals, I found that many of these interventions directly train health professionals on how to weight loss counsel or refer patients to bariatric clinics. Researchers have only limited time to spend with health professionals in these interventions. So the fact that they spend any time on anti-obesity training shows how highly they prioritize this goal. In addition to advocating for obesity education, I also found that weight stigma researchers and advocates are increasingly pushing for expanded access to weight loss drugs when they are asked how to fight stigma. In their view, these drugs prove that obesity is a real disease, so expanding access to treatment is destigmatizing. Together, these examples show that weight stigma researchers and advocates are not working to produce a world in which fat people are viewed more positively. They are working to produce a world in which more fat people receive obesity treatment, which is consistent with being part of the anti-obesity assemblage. And working to eliminate a stigmatized way of being so that people can escape stigma should be understood as a completion of oppression, not a way of fighting it. Essentially, these researchers and advocates are saying that fat oppression can be solved by achieving the goals of fat oppressors, which is morally repugnant. Second, weight stigma researchers and advocates consistently devalue fatness in their efforts to fight obesity, because trying to fight obesity requires talking about fatness as a problem that is bad. I developed a concept for explaining how power is exercised through these claims. Afflictive power. Afflictive power is the capacity to define a way of being as a source of harm or suffering, and as a threat to individuals or populations. Afflictive power is exercised through claims about a way of being as threatening or burdensome. I found that weight stigma researchers and advocates consistently exercise afflictive power in the claims they make about obesity. They portray fatness as a threat in need of elimination by claiming that obesity is a dangerous disease and epidemic. And they portray fatness as a source of physical and mental suffering to fat people and the people around them by uniformly representing fat people as pitiful, miserable, and sick. Of course, this also means that their materials do not make positive claims about fatness or fat people, which is, like the number one way of reducing stigma. Instead, at best, they portray people with obesity as empowered to stand up for themselves at the doctor and demand weight loss drugs. I also found that a minority of weight stigma research and advocacy treats weight stigma as a consequence of obesity. They frame obesity as the source of stigma, listing stigma alongside the health consequences that they claim are caused by obesity. So this turns stigma into another way that fat people suffer as a result of being fat, rather than a social problem. So again, weight stigma researchers and advocates are not working to produce a world in which fat people are viewed more positively. They're working to produce a world in which eliminating obesity is a more salient and urgent project. That goal precludes raising fat people's social status, because low social status is the prerequisite for an elimination effort. So this is how the anti-obesity assemblage oppresses fat people, by devaluing them and by directing resources towards elimination over any other goal. And you can imagine, if these mechanisms are appearing in anti-stigma contexts, that they appear much more blatantly in other places. The concept of the anti-obesity assemblage should fundamentally reorient how we study anti-fatness. To date, most fat studies research has focused on the construction of fatness or obesity itself. My work shows that we should shift from this focus on fat to a focus on fat oppression. It doesn't really matter whether the basis for anti-obesity efforts is valid or invalid. What matters is those efforts themselves and their consequences. We don't need to know the scientific truth about fat bodies to be able to claim that fat people are oppressed by the efforts to produce a world without us. That said, the anti-obesity assemblage is a brand new theory. We need research into the assemblage itself and its effects. Descriptive research about the anti-obesity assemblage will help make it visible to those who are not yet aware of its existence. We also need research that provides evidence of the ways that anti-obesity efforts harm fat people. The concept of the anti-obesity assemblage provides a new vocabulary and a common enemy for fat activists. It's high time that our movement focuses on injustice. And we can begin that work by asking of any statement or policy, does this expand or otherwise legitimize the effort to produce a world without fat people? If the answer to that question is yes, then the policy or statement or technology in question is oppressive to fat people and should face resistance on that basis. The concept of the anti-obesity assemblage also reveals why it has been so ineffective to focus all of our attention on disproving or undermining only one part of anti-obesity efforts, as we have with the BMI for the past 5 or so years. Right now, even the American Medical Association admits that the BMI is flawed, but that has not led them to divest from the anti-obesity assemblage. We also don't need to focus on whether this new class of weight loss drugs like Wegovy and Zepbound will work to make people thin in the long term. That's a separate question from whether the massive effort to eliminate obesity with pharmaceutical treatment oppresses fat people. It does. The existence of the anti-obesity assemblage systematically constrains fat people's life opportunities and ability to flourish. The anti-obesity assemblage should thus be the target of our activism. When valuing fatness has been rendered so unthinkable, rejecting blame and condemnation for being fat appears like the best possible outcome. We must reject this limited thinking. Fat people deserve more than to be treated as a misfortune that the world must hold its nose and tolerate. A world without the anti-obesity assemblage is possible.